Hello and welcome to the family therapy lecture, guys. So, family therapy is a type of a psychotherapy that involves all family members. Okay, it helps the patient and family members change how they interact with each other, change how they solve conflicts, and reduce distress in the family. So, family has been recognized as a source of support as well as a source of distress for many people. So, when you have a patient with an illness, the patient's symptom may be for the symptom for the larger family. So, family therapy may be an integral part of a patient's treatment plan. So, just like the society has evolved over years, so has the definition of the term family. So, so it affects those involved in family therapy. So those people a patient considers to be a family, they may not be related by blood, but they may still provide support, develop patterns of interactions, and maintain long-term roles and relationship in a patient's family. And that will be considered the patient family. So healthcare team, they need to consider patient's family to include whoever the patient defines as family. Okay. So the term family refers to a person's childhood family. This generally includes the patient parents, siblings, first order relatives, for example, the aunts, the uncles. We have an intergenerational family which includes patients' family members from more than one generation. Okay, it could be first generation and second generation and even third generation. So the term family for procreation, this one refers to the family that a person establishes or creates with a spouse or significant other and children. So family therapists are typically psychiatrists, psychiatric mental health nurses, practitioners, psychiatric mental health clinical nurse specialists. Okay, so long as they are able or they have undergone training, specialized training and certification in family therapy. So the therapeutic approach used during family therapy varies with the training, experience, preferences, and judgment of the therapist, who may choose several different techniques based on the situation at hand. So we have several types of family therapy approaches. So the first one we have cognitive behavioral therapy. This therapy or technique uses various techniques to help family members change how they think or behave to solve their own problems. It involves implementing specific behavioral problems to help the patient change negative thinking. So the patient may be assigned to practice these problems between therapy sessions. So from cognitive behavioral therapy, we have supportive counseling. So this brings family members together in a safe, caring environment so that they can speak freely about a problem they may not be able to deal with at home. So the therapist encourages all family members to share their feelings about the problems, facilitate their interaction with each other towards resolving the issue, and offer advice and information about support services as necessary. We also have the psychodynamic therapy, and this technique enables the family members to see and understand the real reason in addition to those apparent on the surface. So for those for what's occurring in a problem situation. So it gets to get the real reasons in addition to what may be at the surface. So the therapist helps family members to see what individual subconscious processes may be contributing to a problem situation, which may help them resolve the problem. The last one is systemic therapy. Okay, and this one considers family as a unit and recognizes that when one family member changes, other family members are affected and thus they need help. So in family therapy, we could have cognitive behavioral approach, supportive counseling, psychodynamic therapy, and systemic therapy. So those are four family therapies. So in conclusion, we can say that the therapist should examine the attitude, behavior, and problems of the family as a unit to determine how the family dynamics influence a problem. The therapist also focuses on the family relationship and communication patterns rather than on one or more family members as their source of the family difficult. So those are the four different types of family therapy: cognitive behavioral therapy, supportive counseling, psychodynamic therapy, and systemic therapy.